All right, so great veins of the neck. So the internal jugular vein connects to the subclavian vein. So you've got your subclavian vein right here, okay? Subclavian, and then goes into the brachiocephalic. So your external jugular vein right here comes down and joins that right subclavian. So does the internal jugular. Internal jugular is right there. Okay, so it joins that. Or sorry, no. This is your internal jugular. So the internal jugular and that right subclavian combine to create the right brachiocephalic vein, as it says right there. So the right and left brachiocephalic veins join to form the SVC. So SVC, right subclavian. Each external jugular vein joins the respective subclavian vein. Okay? So the three pairs of major veins that drain the head, face, and neck region are the external jugular, your internal jugular, and your vertebral vein. So this one here is the vertebral vein, and you can see it's embedded in the vertebrals. The external jugular vertebral vein come down onto the subclavian vein, and then your internal jugular comes down, meets that right subclavian, becomes the right brachiocephalic vein. So your dura mater sinuses, they're venous channels. So you have an inferior sagittal sinus, you have your superior sagittal sinus. Your inferior sagittal sinus reaches a point called the straight sinus. Your superior sagittal sinus comes all the way around and then joins to the confluence of sinuses right there. So the internal or the inferior sagittal sinus, the superior sagittal sinus, and then that sigmoid sinus. That's the confluence of sinuses. Also your occipital sinus. So your occipital sinus comes in, your inferior sagittal sinus, your superior sagittal sinus to that confluence comes out through the sigmoid sinus. Okay, so sigmoid sinus, once again, S. So there's an S pattern to that. So the sigmoid sinus and then the internal jugular. So the dural sinuses are venous channels that drain the blood from the brain found between the layers of dura mater. Okay, so the meninges are the coverings of the brain, and they protect the brain by housing the fluid-filled space. They function as a framework of blood vessels, um, and then the dura mater, the arachnoid mater, and the pia mater. The primary function of the meninges of the cerebral spinal fluid is to protect the central nervous system. And then the space between the pia and arachnoid mater is the subarachnoid matter, or space, subarachnoid space, and that's filled with the cerebral spinal fluid. So you have pia mater, arachnoid mater, and then you have the subarachnoid space, which houses and contains the cerebral spinal fluid. So the cranial venous system, once again, is just another image of what we'd kind of talked about. So you have your superior sinus, you have your inferior sinus, you have the confluence of sinuses, a transverse sinus that they didn't talk about before because you couldn't see it. So the confluence of sinus, the sigmoid sinus, the internal jugular coming down, you have the external jugular, you have your subclavian vein, and then you have your brachiocephalic vein. Okay, so this is all to drain the blood out of the brain and back into the heart. So the thoracic aorta You have the brachiocephalic artery. So we talked about there's 3 branches off the aorta. So when it comes out of the heart, you have your ascending aorta. You have your first is the brachiocephalic. Then you have the left common. And then you have the left subclavian. The 4 segments of the thoracic aorta is the aortic bulb. So right off the bat, you have the aortic bulb. Short ascending aorta, you have the aortic arch, and then you have the descending aorta coming down. Okay? So you have variations of the aortic arch. Okay, so these are variations that are seen. The most common ones, I guess. So the left circumflex aorta. So A. So the left circumflex is where it comes up. You have your aortic arch, and as it descends down, it comes down, comes over to the right, and then back to the left. So left circumflex aorta, normal arch with a descending aorta downward and arched to the left. Okay, so this is arched to the left is what they're talking about, not this way. So inverse aorta, arch is arched to the right. So instead of coming this way, we're now seeing that we're coming up and coming this way. These that come off are still the same 3. They're just coming off in different orders. Okay, so this one comes down to the right. This one here can be a little bit confusing. So it's circumflexing back to the left. Okay. So it comes out, curves to the right, and then comes back to the left. So left circumflex. Inverse aorta, this is arched to the right. Okay, so to the right. All right. And then a pseudo coarctation is an arched descending aorta. So everything is good. It comes up, it has the arch, and before it comes back down, it takes another little arch before it descends. So pseudo-coarctation is just an arched descending aorta. So basically double arched, pseudo arch. This is the pseudo arch, and that's how you're going to keep them separated. So your thoracic veins, the major veins within the chest are the superior vena cava, the azygos, and the pulmonary arteries. So the superior vena cava returns the blood transported from the thorax to the right atrium. Okay, so the superior vena cava from the thorax to the right atrium. So from the thorax to the right atrium. The azygos vein is the major tributary. Returns blood from the posterior thoracic to the superior vena cava. Okay, so this is from the thorax, this is from the posterior thoracic wall to the superior vena cava. The superior and inferior pulmonary veins return oxygenated blood from the lungs to the left atrium, and we talked about that when we talked about the heart itself. So the IVC, inferior vena cava, returns the blood from the abdomen and lower limbs to the right atrium. So IVC, inferior vena cava, right there, returns the blood from the abdomen and the lower limbs to the right atrium. Okay, and you can see here, so this is rib 12, okay, right there. So the inferior vena cava, that's why it's everything from the abdomen and the lower limbs comes back up, okay, and that goes to the right atrium. So branches of the abdominal aorta, you have the first branch, which is the celiac trunk or the celiac axis. The second one coming off here is the superior mesenteric, okay? The left renal, so left renal right there, so left renal. Superior mesenteric, you have your right renal right here, all right, and then you have your inferior mesenteric, So a superior mesenteric, inferior mesenteric, right renal, left renal, and then the first one is the celiac axis. Okay, so the internal iliac arteries supply blood to the pelvic organs, urinary bladder, rectum, reproductive organs, and the pelvic muscles. So, organs supplied with blood by the three large branches of the celiac trunk are the liver. So the celiac trunk is the liver, the spleen, and the stomach. So spleen and then stomach. Okay, so everything kind of conglomerated right in there. The superior mesenteric artery, so we talked about the superior mesenteric artery, supplies blood to the pancreas, most of the small intestines, and portions of the right side of the large intestines. The inferior mesenteric, so your inferior mesenteric artery originates from the aorta, and blood is supplied to portions of the large intestine, okay? And then the right and left renal arteries supply blood to the kidneys. So abdominal veins. So just like we have the arteries, we have the veins. So we have a left renal vein, so that takes the blood back. The right renal vein back from the right kidney. You have the hepatic, which when the blood from the portal vein goes into the liver, and then it's cleaned up and sent back to the hepatic vein, back up into the heart. You have an inferior mesenteric, you have a superior mesenteric, and that's draining the blood back. The left external iliac, which would also be a right external iliac, that drains the blood from the limbs back up. You have your common iliac, so your right and left iliac, okay, come up and make a common iliac to the IVC. You have the hepatic portal system, returns venous blood to the liver. So the splenic vein, so the spleen, the splenic vein, your inferior mesenteric come in, your superior mesenteric come in. They form to create the portal vein into the liver. You have a right portal vein, a left portal vein, and then you have hepatic veins all throughout the liver that confluence into the inferior vena cava and then back to the right side of the heart. The hepatic portal system includes all the veins that drain blood from the abdominal digestive tract, from the spleen, colon, and small intestine. From these organs, the blood is conveyed to the liver through the portal vein. So to the liver through the portal vein. The superior mesenteric veins and splenic veins unite to form the portal vein. So splenic veins, superior mesenteric form the portal vein, and then the blood from the portal vein into the liver. So the upper limb, this is blood to the upper limb from the brachiocephalic to the right subclavian, down the axillary to the brachial. You're splitting off, so you have your radial, your ulnar, and then your deep palmar arch, your superficial palmar arches. So this is blood to the upper limb from the brachiocephalic off of the aortic arch. The veins, so the blood return back radial ulnar, your medial cuboidal, your brachial, your cephalic, they form the subclavian, your subclavian to your superior vena cava, and then into your heart. So superficial veins are your cephalic vein, your basilic vein, your median cuboidal, which is the most commonly used to draw blood from the arm. Okay, so your medium cuboidal, that's where they're sticking when they're taking blood from your arm. Deep veins, you've got two branches, so those are deeper inside the arm. You have the radial down here, so that's a deeper vein. You have your ulnar, which is a deeper vein, and then you have your palmar arch right there. So deep palmar arch, those are deeper veins, not used to draw blood. Usually that median cuboidal, sometimes superficial veins in the arch and in the back of the hand. So your lower limb arteries, you have the external artery to the femoral. It branches. You have your lateral circumflex femoral. You get some deep arteries to the thigh. The back of the knee, you get the popliteal. You get your posterior tibia, your anterior tibia, so one posterior, one anterior, and then your dorsal pedis arteries. So those are the ones that supply blood to your lower limbs. And then your lower limb veins that draw the blood back up to your inferior vena cava. The superficial, the great long saphenous vein, and then the small short saphenous vein. So you have your great, and then you have your small. So your small is posterior, your great is anterior medial. Deep veins are your posterior tibial, your anterior tibial, your popliteal, and then your deep femoral. So those are all deep veins, and then these are superficial. The great saphenous vein is the longest vein, so the great saphenous is the longest vein. It extends from the foot along the medial aspect of the leg to the thigh, where it opens into the femoral vein. So from the foot to the thigh, and then where it opens into the femoral vein, that is the longest vein that we have. So lymph drainage, we're going to talk about lymph drainage in the next couple of slides. I'm going to end it here and post this one, and I'll pick up with lymph drainage.